Welcome back, my dear friends. Welcome to my channel. So far, I have discussed about the chords of brachial plexus and the branches of brachial plexus. So, how to identify we have learned yesterday. So, today we are going to find out the nerves which are extending into the arm, and some nerves are extending to the forearm and then the hand. So, how to identify these nerves in the arm, in the forearm, and in the hand? Let me explain about it. So, before going to see that, please subscribe to my channel. Let's get started. So the first nerve which we are going to see is axillary nerve. So this axillary nerve is a branch of posterior cord of brachial plexus. So it is very easy structure to identify it. So how to identify is, so it is the branch of posterior cord of brachial plexus, and then it is encircling, it is running posteriorly and runs along with the posterior circumflex humeral artery and encircles the surgical neck of the humerus, and it supplies to the inner aspect of the deltoid muscle, and also it is supplying to the teres minor. So if they tie any nerve which is under the deltoid muscle, any nerve under the deltoid muscle which is encircling the surgical neck of the humerus, that structure is definitely is going to be axillary nerve. If it is any vessel, so if it is appearing like an artery, you can write it as posterior circumflex humeral artery. Okay, so the axillary nerve, what the next question they may ask is any clinical aspect they may ask. So what are the clinical aspects of this axillary nerve? And the posterior circumflex humeral artery, what are it is a branch of which artery, like that they may ask. Okay, so that is about the axillary nerve. Now in our previous class we have seen the median nerve. So median nerve identification in the axilla. So I have told you that there are two roots which are going to join with each other. One is lateral root of lateral cord, and one is medial root of medial cord. So this lateral root and the medial root which are going to join with each other and forms the trunk of median nerve. So that nerve, median nerve trunk, which is present lateral to the third part of the axillary artery and as well as to the brachial artery. So upper half of the brachial artery, in the upper half of the arm, the median nerve location is lateral to the brachial artery. So if any structure, any nerve which is tied in the arm, which is present lateral to the brachial artery, that it is nothing but the median nerve. Then after that, how it is running? Let me show you that. So after that, in the lower compartment of the forearm, compartment of the forearm, it is crossing the brachial artery and runs medial to the brachial artery. So in the upper half of the arm, it is present lateral to the brachial artery. In the lower compartment of the forearm, it is present medial to the brachial artery. Then it is enters into the cubital fossa. Here I am showing you the left-sided upper limb. In the left side upper limb, we can see that this is the median nerve and it is entering into the cubital fossa. Then after that, it disappears. So this is the median nerve and it is disappearing here. Then after that, how to identify if any nerve which is tied in the cubital fossa most medially, if it is appearing like the thick cord-like structure, that is nothing but the median nerve. Okay, so already you have been experienced to identify the artery, vein, and nerve. You know how to distinguish. So if any artery is tied, that is, if any structure which is having a lumen, you can feel that lumen, and that is definitely the artery or vein. So if it is having a collapsed lumen, means if you compress the structure, if it is not regaining its shape, that it is vein. If it is regaining its shape, that is nothing but the artery. If it is tough cord-like structure, that it is a nerve. So in the cubital fossa, most medially, the nerve which is present here is median nerve. Okay. So far, I have seen how to identify the median nerve in the upper half of the arm, in the lower half of the arm, then in the forearm. In the forearm, how it is entering into the forearm is, it is passing between the two heads of pronator teres, So it is passing between the two heads of pronator arteries. That's why I have told you in the previous slide. It is disappearing after it enters into the cubital fossa. Then where it is going? It is passing between the two heads of pronator arteries and enters into the foramen. Okay, so here I have just relieved the median nerve from the two heads of pronator arteries, and then I have exposed it and then just pulled it upwards, and you can see the branches of this median nerve. So in the foramen, how to identify this median nerve is, it is a lateral structure. Okay, so after it enters into the cubital fossa, it is the most medially. Then it enters into the foramen by passing between the two heads of pronator arteries, and then extends into the foramen, and then it is running lateral part of the foramen. Okay, and then it is supplying, this median nerve is supplying to the all muscles of the foramen except the flexor carpi ulnaris, and also the medial aspect of the flexor digitorum profundus. So to identify the median nerve in the foramen, so it is a lateral most structure. So the vessels which we can identify in the foramen, there are brachial artery divides into radial and ulnar. The radial artery which is running laterally, ulnar artery which is running medially. Okay, so here you can see this is the median nerve which is running laterally, and this is the radial artery, and this is nothing but the ulnar artery. Yeah, after that, sometimes they may ask another nerve. It is a branch of the median nerve that is very deep structure. Sometimes you may ask this anterior interosseous nerve. So how to identify this anterior interosseous nerve is, so to find that nerve, they have to remove all this superficial group of flexor compartment muscles, means all the pronator arteries, palmaris longus, flexor digitorum superficialis, and also the flexor carpi radialis. All the muscles have to be removed in order to say this deepermost structure, that is anterior interosseous nerve. Here you can identify. So this is the anterior interosseous nerve, which is a branch of the median nerve. Okay, if they want to ask this, if they tie any nerve which is present most deep underneath the superficial group of flexor compartment muscles, that it is nothing but the anterior interosseous nerve. Then after that, what happens to the median nerve? So this median nerve, it enters into the lower aspect of the forearm, and then it runs medial to the palmaris longus tendon, and then it enters into the hand by passing beneath the flexor retinaculum. There's a fibrous sheet called as flexor retinaculum. Under the flexor retinaculum, this median nerve is passing and enters into the hand. In this picture, you can identify it is entered into the hand, and then it supplies to the intrinsic muscles of the hand. What are the muscles are supplied by it? So in the practical examination, they may tie this median nerve in the forearm and ask you what are the muscles supplied by the specific nerve. Okay, so what are the muscles supplied by the median nerve in the forearm? All the flexor compartment muscles except flexor carpi ulnaris, and also the medial aspect of flexor digitorum profundus. Then after it enters into the hand, which muscles are supplied by it? That is also the question usually they ask. So here you can see that. So I have just separated the flexor retinaculum and then exposed the median nerve. So it entered into the hand, and then it is supplying to the three thenar muscles, and the first and second lumbricals, they are supplied by the median nerve and its branches. So sometimes they may tie this median nerve and ask you the question, what are the muscles of the hand supplied by this median nerve? That is the question usually they ask in the examination. Okay, so three thenar muscles and the first and second lumbrical, they are supplied by this median nerve and its branches. And the cutaneous innervation, I will show you another slide. Yeah, here you can see that. Yeah, in this first picture, you can see how it is. It is a right-sided upper limb. We can identify this as a median nerve, which is formed by the joining of two roots of one is lateral root is coming from the lateral cord, medial root is coming from the medial cord, and two roots are joining and forming the trunk of median nerve. Then in the cubital fossa and here in the forearm, then it enters into the hand. So the cutaneous innervations, it is also the question they usually they ask. So lateral 3.5 fingers, lateral 3.5 fingers, one means the thumb, then you can see the index, middle, lateral 3.5 fingers are supplied by the median nerve fingers, and also the anterior palmar aspect, lateral aspect of the palm is supplied by the skin of the lateral aspect of the palm is supplied by the median nerve, and also the posterior aspect of the hand at the uh, distal phalanges, skin over the distal phalanges is supplied by this median nerve. Okay, there is a cutaneous innervation of median nerve. Now let us see the ulnar nerve. How to identify the ulnar nerve? Ulnar nerve, where we have seen in the axilla is, we have seen between the axillary artery and the axillary vein, we have seen two structures. One is medial cutaneous nerve of the forearm, and underneath this medial cutaneous nerve of the forearm, we can identify the thick nerve is called as ulnar nerve. Here you can identify that. Okay, this is nothing but the ulnar nerve. So it is a branch of the medial cord of brachial plexus, and as the medial cutaneous nerve of the forearm, it is a cutaneous innervation and which is supplying to the medial aspect of the forearm. Then ulnar nerve, which is running between the axillary artery and the axillary vein, then it is running between the brachial artery and the brachial vein. Then after that, yes, what is going to happen to this ulnar nerve is it is running posteriorly by piercing a septum which is present over here, that is medial intermuscular septa in the lower aspect of the forearm, lower aspect of the arm, and then it enters into posteriorly. It enters into posteriorly, and what is going to happen? Let us see that. Yeah. So after it enters into the posterior aspect of the lower aspect of arm, it is crossing the medial epicondyle. So it is a easy nerve to identify. Easy nerve to identify. If any nerve is crossing the medial epicondyle, try to touch the nerve in the dissection and feel the nerve which is present posterior to the medial epicondyle. So that nerve, definitely, if it is a thick cord-like structure, then it is definitely the nerve. That nerve is ulnar nerve. Then after that, what is going to happen to this ulnar nerve is it is passing between the two heads of flexor carpi ulnaris. Flexor carpi ulnaris. This muscle is nothing but flexor carpi ulnaris. So after crossing the medial epicondyle, it is disappearing. Then it enters into the forearm. How it enters into the forearm? So in the arm, how to identify which is present between axillary artery and the axillary vein and brachial artery and brachial vein. Then after that, it is running posteriorly. Now, so here you can see that it is crossing the medial epicondyle and then disappears. So why it is disappearing? It is passing between the two heads of flexor carpi ulnaris and then appears in the lower aspect of the forearm, which is lateral to the flexor carpi ulnaris muscle and medial to the flexor digitorum profundus muscle. Medial to the flexor digitorum profundus muscle, along with the ulnar artery, it is running. Okay, so in this course, it is supplying to the flexor carpi ulnaris, and also it is supplying to the medial aspect of flexor digitorum profundus. Then what is going to happen? It is enters into the hand by running beneath the flexor retinaculum. Yeah, here you can see that it is passing beneath the flexor retinaculum and then enters into the hand, So the examination, they ask what are the branches, what are the muscles supplied by the ulnar nerve. So what are the muscles of the hand supplied by the ulnar nerve? So what are the muscles? Means hypothenar muscles, and also the third and fourth lumbricals, palmar interossei, dorsal interossei, and also the adductor pollicis. It is also supplied by the ulnar nerve. So these are all the muscles supplied by the ulnar nerve. And the cutaneous innervation, it is medial 1.5 finger. Medial 1.5 finger is supplied by the ulnar nerve. Medial 1.5 finger, and the palm skin over the palm, medial aspect of the skin over the palm is supplied by the ulnar nerve. Then radial nerve. So radial nerve, it is very interesting. So the radial nerve, which we can identify over here, so it is a branch of posterior cord of brachial plexus. So the first muscle which leaves the neurovascular bundle in the axilla is nothing but the radial nerve. Then what is going to happen to this radial nerve? It is running posteriorly. Yeah, here you can see that. So this radial nerve, this radial nerve, which is running posteriorly by passing in the lower triangular space. Let me show you that. Yeah, here you can see the radial nerve. Yeah. So it is running posteriorly along with artery, which is a branch of the brachial artery, that is profunda brachii artery. So this radial nerve, after leaving the neurovascular bundle, it enters into the lower triangular space. You can see the lower triangular space. So lower triangular space, I have done a video also. So you can just have a look at it. Okay, then after it enters into the lower triangular space, it is running posteriorly, and then it is supplying to this triceps brachii. Yes, after supplying to the triceps brachii, how to identify that radial nerve? If they tie any structure at the posterior aspect of the arm, definitely that is nothing but the radial nerve. Why? Because there is no other nerve which is present in the posterior aspect of the arm. Thick nerve. Maybe cutaneous nerves may be present, which are present very superficially. But if you find any nerve which is present very deep and the posterior aspect of the arm, and which is present obliquely, that is nothing but the radial nerve. So here you can see that radial nerve. Then after that, what is going to happen? So this radial nerve, after supplying to the triceps brachii, and it is piercing the lateral intramuscular septa, then after that it appears in the lateral aspect of cubital fossa. Then after that it extends into posteriorly and supplies to extensor compartment of forearm. So the nerve which is supplying to the posterior aspect of the arm and posterior aspect of the forearm is nothing but the radial nerve. Yes. So already I have told you about it, how it appears in the cubital fossa, lateral part of the cubital fossa. Then it divides into superficial and deep branches. So the superficial branch, which is running lateral to this radial artery, and then at the lower aspect of the forearm, anterior aspect of the forearm, and then it is running posteriorly and supplies to the dorsum of the hand. Whereas the deep branch which is running posteriorly and supplies to the extensor compartment of forearm. So sometimes if you find any nerve which is at the posterior aspect of the forearm, that nerve is nothing but the radial nerve. Okay, so posterior aspect of the arm, the only nerve, the thick nerve which is obliquely present running along with the artery, profunda brachii artery, that is nothing but the radial nerve. In the forearm, the one nerve which is present and supplying to the extensor compartment of forearm, that is nothing but the radial nerve. Okay, so after that it is supplying to the dorsum of the hand, cutaneous nerves which are supplying to the dorsum of the hand. Okay, so these are the nerves which we can identify in the practical examination.